So we have selected some papers to present you, which we think they are of interest. They have implications for clinicians and patients in real life, or current or some of them future implications, we hope. There's definitely all the papers have scientific value. They are of groundbreaking research, and the data we are showing today come from the authors. And the authors of the papers which are going to be commented on, they have been invited, and some of them, they are here. So you can ask your questions to the members of the ISL Governing Board who are going to present the data, but if you wish, you can also include the authors who are here to answer some of your questions. So we start with the first presentation, which is by Professor Fabien Joulim, who is an ISL educational counselor, and he will comment about hepatitis B highlights and how we may move towards a cure. I'm sure you know that the treatment of hepatitis B has dramatically improved over the last 10-15 years, but still we cannot eradicate the virus, and this remains a problem for HBV-infected patients. So Professor Joulim will show us some new efforts aiming to cure of these patients. So please, Professor Joulim.
Okay, thank you, George, and good morning to everyone. Okay, so we try to give you an overview on the highlights regarding hepatitis B and how we see the field evolving towards a cure. So just to set the scene, as you know, we have safe and effective antivirals for hepatitis B, and clinically now one of the major concern or issue is to identify HBV carriers, because many of them are not aware of their disease. And for those who are already identified, one of the questions is whether we should treat chronic infections earlier to have a significant impact on the prevention of the complication of the disease. So there are a couple of presentations addressing these issues. So there's a presentation on the a surveillance program for hepatitis B and C in Europe, which is coordinated by the ECDC, the European Center for Disease Prevention and Control. Just as a summary, ECDC coordinates this surveillance program for hepatitis B and C in 30 countries of the European Union to really improve the epidemiological understanding of acute and chronic hepatitis infections across Europe. This program has started in 2011. And here they will present preliminary data, and more results will be published around the World Hepatitis Day 2013. It's, as you will see during their presentation, during the parallel sessions, it's really a description of what's going on in terms of the epidemiology of hepatitis B, as well as for hepatitis C across Europe. And really this is something that is very important to evaluate the public health burden of these chronic viral infections in Europe, and try to implement programs to prevent and control the transmission of these infections. So this is really a very important program in terms of public health issues. Now, a second study with respect to antiviral treatment is addressing the question of whether we should treat patients earlier because currently with the recommendations from international societies, antiviral treatment is indicated when patients have progressive liver disease, And now the question is, since we have better drugs with very low rate of resistance, drugs that are very potent and achieve a high rate of viral suppression in the majority of patients, with a very good safety profile, the question is whether we should try to start earlier the treatment so that we could have a treatment intervention that would prevent the infection to progress to a liver disease. And one of the questions is if we could treat patients in the immune tolerant phase that is defined by normal ALT levels, normal transaminase levels, and high viral load, high HBV DNA levels. So there's going to be one study that will be presented during the meeting on tenofovir therapy in this category of patients. So the study design is the following. Patients with an immune-tolerant profile who are randomized to receive either tenofovir or a combination of tenofovir and FTC, which is anthracitabine. And here you see the results of this study. So we have results now after 4 years of therapy. And you see the rate of viral DNA suppression. And you see here that there's a good rate of suppression when patients receive tenofovir monotherapy. Approximately 50% of the patients achieve viral DNA suppression. But those who receive the combination of tenofovir and anthracitabine in a single pill achieve viral suppression in 76% of the cases. So this is the first report, to our knowledge, showing results in this category of patients with immune tolerance. And now when they look at a multivariate analysis of treatment response, it was interesting to see that female respond better than male, whatever treatment arm. And patients who received the combination, again, whether they were male or female, responded better than the monotherapy with tenofovir. So this is, as I told you, really the first study of antiviral therapy in immune-tolerant patients, which provide results showing that we can achieve viral suppression. However, there's a low rate of e-antigen loss and seroconversion. And we've seen that gender and combination therapy are important factors in terms of viral suppression. And there was a very good safety profile during the 4-year treatment period. Now, these were really the main clinical findings. There's a lot of very interesting studies assessing the identification of new targets for antiviral therapy, because with the nucleoside analogs we achieve viral suppression, but we don't achieve a cure. So the current treatments do not achieve HBS loss or cccDNA loss, and the major question is whether we can target cccDNA. Here's just a scheme to show you what we could do around cccDNA. There's one aspect, which is cccDNA dilution with hepatocyte turnover. I will come back to that. Another approach, if we cannot eradicate cccDNA, would be to silence cccDNA. And the ultimate goal would be to destroy cccDNA and get rid of it. So there are very interesting studies that will be presented during the meeting regarding these 3 aspects. So one of these study is looking at the effect of hepatocyte proliferation on the decrease of cccDNA in the liver. And in that study, the group of Maura Dandry used a humanized mouse model to study this particular aspect. And what they showed is that when you transplant human hepatocytes in these immune deficient mice, you have a proliferation of the ungrafted hepatocytes in the recipient mouse livers. And they look at the evolution of cccDNA in these animals, and obviously they are here to answer questions if you want after the presentation. Well, and what they showed is that when you have cell proliferation, you have a rapid reduction of cccDNA copies per cell, as well as the number of viral transcript in the infected cells. However, complete cccDNA eradication was not achieved, as you could see here, in the absence of antiviral treatment, and maybe because de novo infection could be reestablished in the quiescent human hepatocyte. So indicating that hepatocyte proliferation and regeneration is important in this dilution effect, but if you want to be even more potent, we will need to add an antiviral treatment. Another aspect is, if we cannot get rid of cccDNA completely, is try to silence cccDNA. And this is a presentation from Massimo Levrero's group, who is also here in the audience, looking at whether small molecules can target the epigenetic control of this viral mini chromosome. And these are experiments that are performed in tissue culture, in hepatocyte culture, and they look at the epigenetics of the viral mini chromosome to look at the transcriptional activity of this particular form of the viral genome, and they try to use drugs that target either the histone acetylation or histone methylation. And just as a summary, just to show you some of their results, you see that with drugs targeting either methylation or acetylation, you can really decrease the transcription activity of cccDNA with these small molecules, although cccDNA is not eradicated. So that's another proof of concept, because the same group had shown earlier with interferon that you could do a similar job, but here with small molecules which may have the advantage in the future to be a little bit better tolerated, we hope. This could be a way to silence cccDNA. Obviously, this will need to be confirmed by more experimental evaluation and then in clinical trials if results are still promising. So the third aspect regarding cccDNA is whether we can get rid of cccDNA once it's already established. And the group of Ulrike Protzer has studied the effect of the activation of lymphotoxin beta receptor, and they showed that by activating this pathway, this may lead to degradation of HBV cccDNA from infected cells. So here's just showing that they use antibodies that agonize the receptor of the lymphotoxin beta, and which activates cell signaling within the infected cells. And the results, the main results are shown here. And you see that by stimulating this pathway, you can see a decrease in the amount of ccc-DNA in the infected cells. And what they showed is that this effect is dependent on ApoBec 3b, which is known for its deaminase activity. And we can discuss later on more detail the mechanism of action. And you see that when they inactivated this ApoBec 3b gene, you could lose the effect on ccc-DNA. So really confirming that this effect was ApoBec 3b dependent. So I think that this is one of the first study showing that we can, by activating a signaling cascade, we can destabilize ccc-DNA and lead to degradation of ccc-DNA. So this provides new hope for the development of therapies with the hope to cure the infection in the future. So in summary, for the highlights of hepatitis B, so there will be a very interesting study on the epidemiology of the chronic infections, Hep B and Hep C. Really a first study of antiviral treatment in immune-tolerant patients, which is a very important study. And regarding ccc-DNA, very important studies of the pathobiology of ccc-DNA, which may translate in clinical development in the future. And thank you for your attention.